Thank you for joining me today. In this video, you will learn naloxone. What is naloxone? Naloxone is a medication that treats alcohol withdrawal. It is classified as opioid antagonist, non-opioid, non-addictive. It is structurally related to naloxone and oxymorphone. It's related to that structurally, and it called Revia. Naltrexone. Naltrexone is related to naloxone. So here you will learn naltrexone. Naltrexone is mechanism of action is a competitive antagonist at the opioid receptors, blocks euphoric and reinforcing effective of opioids. It reduces alcohol craving by endogenous opioid systems moderation, and does not cause a tolerance or dependency. It will precipitate withdrawal if opioids are present. It is approved alcohol use disorders. It reduces relapse risk. It decreases craving and heavy drinking days. Opioid Use Disorder is also approved for opioid usage disorder. Relapse prevention only. For opioid usage disorder, you can use this medication for relapse prevention only. It requires complete opioid detoxification before initiating this medication. This medication is not for acute opioid withdrawal. This medication is not for substitute for opioid agonist therapy like methadone or bupropion. So it's not. This medication, Revia, comes with oral tablet and extended release injections monthly or separate. So it's naltrexone has oral and monthly injection. For alcohol usage disorder, you want to prescribe 50 milligram orally once a day, and alternative dosage are 100 every other day or 150 milligram every 3 days. Opioid usage disorder, you want to begin with 50 milligram first every day and start after the opioid-free intervals. Greater than 7 days, short-acting opioids. So when the patient didn't use opioid for at least 7 days, or more than 10 to 14 days for long-acting opioids, like the methadone. This medication is contraindicated for current opioid usage or dependency. If the patient is still using the opioid, or if they are still dependent to opioid, this medication is anti-indicated for that. Contraindicated. So you cannot prescribe or use this medication with opioid or dependency. It's also contraindicated positive opioid urine screen. When you test the urine for the patient and they have a positive opioid urine screening, you cannot prescribe this medication to them because it's contraindicated. It's contraindicated for acute opioid withdrawal. It's contraindicated for severe acute hepatitis or liver failure. If the patient has a liver failure or if they have inflammation of the liver, this is contraindicated. If they are hypersensitivity to naltrexone, it's contraindicated. It has a black box warning level safety issue. Precipitate opioid withdrawal can be severe and sudden. Always confirm opioid-free status. So you have to screen urine. You have to know when was the last time the patient took the opioid. Naloxone challenge test may be used. You want to use the naloxone challenge test to make sure that, especially specialized setting. So if the patient is in hospital setting, you want to use naloxone challenge test to make sure that the patient is not still using opioid and they are free from opioid in their system. If the patient is having a hepatic issue or liver disease, it's also contraindicated because this has a hepatic toxicity and which is dose related. Risk increases with more than 50 milligrams a day. So if the patient uses more than 50 milligrams, that can increase the hepatic toxicity, usually reversible with discontinuation, but it has that risk on it. Not contraindicated in a mild to moderate LFT elevation. Common side effects of this medication include nausea, headache, dizziness, fatigue, anxiety, insomnia, abdominal pain. So you want to monitor before initiating this medication.